you?
Oh my gosh. At long last.
How are
Thank
you?
you. How are you doing?
I'm fine, thank you. I'm fine, thank you. Oh, now you're on the side.
Oh dear goodness.
There you go. There you go.
Okay, I'm just gonna hold it. I'm just gonna
There
hold
you go.
There we are.
The life of an MPP. I'm telling you, the life of an MPP.
Thank you very, very much for having me. I was flying back from Queen's Park.
Yes.
We were out there in a car rally, actually, for the SEIU, labor union supporting our frontline healthcare workers. And there we were standing on the grass of Queen's Park, of course, while physical distancing.
Yes.
And
Okay.
they were honking their horns, and we were standing there and with masks, and some folk had other stuff. And
Yeah.
it was all
Listen.
about a message of solidarity. They
Listen.
need their hazard pay, they need their PPE, they need the government to stand up for
There you
healthcare
go.
workers. We need that.
There you go. And listen, I thank you for taking the time out of your schedule. I know it's busy and I know I have limited time, but I really appreciate that you come on this platform here with us still.
Thank you for having me.
I've tried to reach out to many others. Some are getting back to me still. No one has turned me down, but which is a good thing. But you know what I'm saying? Let's see it go further. Let's get right into it if you're
Yes,
ready.
you keep seeing my dirty top of my bookshelf, but who cares?
Okay, don't worry about that. All right, so okay, let's go. Of course, the big thing, it's COVID-19. It's us and it's the government. It's us. It's happening. It's here. My question to you is, it's the current concern, right? That you have to take on, that we have to take on. When do you think it's going to be able to go outside of regular operations again?
Well, you know what, Wiz? Your date is as good as my date. And that is, we have to take our cues from our public health officers. I know that everybody is eager. I am eager for us to get our economy up and running again, but
Yes.
it cannot be on the backs of Ontario's health.
Okay.
We have to be safe. We have to be prepared. We're only going to get one shot to get this right. If we rush, or as our families would say, if we put the cart before the horse, right?
Yeah.
We're going to find ourselves possibly in a second wave of this pandemic, and that is what none of us want. We've been working so hard at physical distancing. We've been our essential workers, for goodness sakes, have been working so hard to keep us fed. Driving us from point A to B on, buses. And of course, our healthcare workers, we can't have done all of that for nothing. So while I'm eager to see the economy come back, it needs to come back in a way that keeps all of us safe. And what we really need to do is ensure that we are making the Ontario government needs to ensure that they are doing enough testing. We have to ramp up the testing. Because without more testing each and every day, we cannot get that full picture of COVID-19.
It's funny that you say testing. So vaccination is a humongous conversation, especially in communities of color. Are you, or is the government, or have you heard they're going to be forcing everybody to be vaccinated, even if they weren't sick with COVID-19?
Well, to be honest, I have not heard that. I mean, there's certainly conversations around vaccines at all times. Those who agree, those who don't, those who are indifferent. I mean, right now, my key message, what I'm telling, my mom, what I'm telling my friends, my family, our community members is focus on what public health officials have to say. What we don't need right now are armchair doctors and nurses, armchair healthcare experts who are in fact not experts. Everyone's got something to say. about how that timelines. The only folks that can really speak to this is our public health officials in terms of timelines and also in terms of what the vaccination plan will be. But what we need our Ontario government to do is to listen to public health officials, and we need them to listen to healthcare workers who are saying in every way they can, we are not getting the full protection from this province that we need. Workers need PPE, personal protective equipment. They need this. This is not a want. It's not a luxury. This is a matter of life and death.
Well, who is stopping this allowance from going on? Who's the main culprit? I'll use the word culprit.
Well, let me say this. The work environment, the workplace environment, the lack of resources, the understaffing that we are seeing in our long-term care homes, this is a direct result. We can go all the way back to the Mike Harris conservative days of slashes and cuts and burns to healthcare. This is the government's responsibility to ensure that our healthcare system is up and running so that our loved ones can be safe. So whether we're talking about Doug Ford, our current premier, whether we're talking about our previous premiers, we know that healthcare has been chronically underfunded for a very long while. And now we are seeing, we are seeing poor, vulnerable Ontarians, reaping what the government has sown. And that is not, this is not cool, it's unfair, and most importantly, it could have been prevented. We've heard the premier today, talking about minimizing access to PPE, to N95 masks to our healthcare providers. I mean, just the other day, literally, not even a week ago, he said in a press conference, hey, if anyone needs PPE, it's available. Call me, just call us. We'll get it to you in 24 hours. Well, I'm here to tell you, folks in my community riding of Toronto St. Paul's, there are healthcare workers who need PPE, who are not getting PPE. And they've been asking for it for a lot longer than 24 hours. So what gives? What gives? We can't take chances with people's lives. We just can't.
Totally agree. Totally agree. What do you see as the new norm then coming out of this? If the healthcares can't get the mask and stuff, are we going to have enough when we are allowed out, or is that going to be the new norm? Or
well, here's the thing. We as official opposition, we are advocating for healthcare workers, for anyone on the front lines who needs protective equipment to have that, because we want people to be safe, and off of the words of our public health officials, we know that, whenever you have to go outside, not only do you have to practice your 6 feet of physical distancing, but wearing a mask, even a homemade mask, it can prevent, it can help, lessen the chances of germs being transmitted between one of us, as we're walking around in our day. So it's very important that we're doing what we need to do. Official opposition, we're going to continue to advocate for the rights of our workers, for the quality of their workplaces, so that they can keep Ontario safe. What we need is, we need a clear plan. We need a transparent plan from the government. We have to fight so hard, alongside community, simply to get Ontario to, get off the dime and do race-based data collection for COVID-19. I mean, we'll see how that turns out. We need them to not only do race-based healthcare data collection for COVID-19, but we need this to be permanent. Going back to what you said, was at the end of the day, COVID-19 has exposed. It has exposed the inequities, that many of us have already.
Oh, you froze.
Services in community, whatever you
Okay.
might call it. That's my phone ringing. I'm just going to decline it.
It,
Sorry about that.
yeah.
You know, so we have to work towards a better tomorrow. We don't want
Okay.
to go back to normal, because normal was not working for many Ontarians. You know, in Toronto, St. Paul's, we got 60%. You know, 60. I think it's actually 67.8% renters.
You're breaking up.
Renters.
Yeah, you're
Pardon me?
breaking up a little. Okay.
Are you hearing me?
Sounds
Uh-oh,
better.
not good.
There
Are
you
you
go.
catching me now?
Can you hear me? Can
I can
you?
hear you.
Okay. Yeah, you're okay. You're okay now.
You
Of
know,
course,
we've
we
got
know
renters. We you know,
we're not going to go back to the
67.8%
norm.
renters. Oh, I'm not hearing you now.
We're not going to go back to the norm, and everybody I think understands that. What we want to know is what the norm, the new norm looks like, and I
Right.
think that's very important for
Right.
us. I mean, you're talking to a lot of people who have family members who are on the front lines here, people
Right on.
who
Yep.
are
Yep.
are loss of
Yep. I've
jobs
got family
right now. A
members
lot of
and
these
friends on the
people
front
listening,
lines.
they have loss of jobs. Uh,
Yep.
they want to know what's going on. Like, okay, for
Well,
instance, the government giving the. Can you hear me?
you are really, 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 really quiet,
Okay,
so I
wait,
can't hear you well.
hold on. Can you hear me now?
Very, very tiny.
Okay.
But it's okay.
So what I'm gonna do?
I'll listen closely.
Okay. Well, no, I don't. I don't. I want the listeners to hear everything. So I'm thinking that I wonder if I should log out and log back in. Hold on a sec. Hold on. How about now? How's good? Is it now good?
It's literally sounding very far away. I can hear you if
Okay.
I'm real close,
So
but
what I'm gonna do is what I'm gonna do is shut down and log back on real quick. Okay?
okay.
I'm just gonna shut down and log back on.
Okay.